Hello, my name is Andrew Khair. I am a 2017 graduate of the Innovation Fellows Program. I also have a bachelor's degree in electrical engineering and a PhD in biomedical engineering from Drexel University, and an MBA with an executive focus from the Carlson School of Management at the University of Minnesota. Prior to joining the IFP, I was a clinical research scientist for a small medical device startup company in the Twin Cities area, where I was traveling around the world setting up clinical sites for a IDE and pre-IDE study that the company was working on. At the same time of that job, before I joined the IFP, I had just started my MBA program, and I knew that my career was at an inflection point. There's this part of me that really enjoyed being a scientist and really enjoyed kind of the technical aspects of that job. But there was another part of me that really was intrigued about taking an idea and going from just an idea to an actual business and to an actual startup. So there was this part that I really needed to explore, and I found that the IFP was just perfect for me to explore what that meant. Some of the things that I learned from the program is really identifying the unmet needs. I think so many times I get to focus, or I would focus on just what is the solution and not really take time to understand the problem. And when you focus on the unmet needs, one of the things the program taught me is focus on the unmet needs really focuses on the problem, which then allows you to find an appropriate solution. I also enjoyed the mentorship. There were a lot of people at the program, both my colleagues who were on the program with me, as well as those who were directing the program at the time, and even alumni from the program. All were really just this wonderful community to discuss and talk through a few things and just really go through what we need to do, what are the needs, how do we build this project, and how do we look at our project teams. When I was at the program, I worked on a project for heart failure with preserved ejection fraction, and I had the opportunity to work with a few people from the University of Minnesota Medical School, as well as Mayo Clinic. When I was done the IFP, I moved to New Jersey to work at a small, privately owned biopharmaceutical company called Ferring Pharmaceuticals, and I joined their medical team as an associate medical director. One of the things that the IFP really prepared me for in this role is really getting up to speed in a therapy area that I really had not much understanding or experience in. And all of a sudden I'm thrust as an associate director working with a team of MSLs on this research in reproductive endocrinology that I, again, had very little experience. But one of the things that I learned from the IFP is really just to really ask the right kind of questions, to really get yourself up to speed really quick on a project or on a therapy area that you need to focus on. What I currently do right now is I'm the Director of Business Development for Reproductive Medicine and Maternal Health for Ferring Pharmaceuticals for all of our U.S. endeavors. I get to hear a lot of pitches from a lot of startup companies. And one of the things that the IFP really prepared me for is understanding what is a good pitch, what isn't a good pitch, and how to determine the two, and what to really look for, but also some of the questions to ask the startups, to really drill down with them and help them understand what is the unmet need and how does this strategically align with a strategic partner like myself in Ferring Pharmaceuticals, and how can we work and collaborate together? What do they need? What can I do for them? And what do we need? What do I need from Ferring Pharmaceuticals, and what they can give me is critical as well. I think the IFP is really good for someone like me, and I can speak from my own personal experience here, someone who's in this mid-career stage, if you will, who's probably about 5 to 10 years into their career and maybe looking to transition from just one siloed endeavor of, say, research science or clinical science, and really branch out and understand what it is, what's the full breadth of what it means to take an idea to a small business. I would also encourage someone who's really looking to expand their network and understand the opportunities that are available there, with the different mentors and different fellows and alumni that are associated with the program. It's been great telling you a little bit about my experience of the IFP and how it's helped me and benefited me now 5 years after graduation. If you have any other questions, feel free to look for me on LinkedIn or reach out to me through one of the mentors of the program.